Welcome to the Heme Consults orientation video series. This is video number 18, and today I'm talking about the sickle cell rounding team. So sickle cell is near and dear to my heart because one of my earliest mentors, she's a doc taking care of patients with sickle cell, and I am always excited to care for patients with sickle cell disease. I want to tell you about the sickle cell team and how they can help you on the consult service. As always, I think today I have 7 things I want to tell you. Number 1, they are a rich resource. They're a rich resource. They manage these patients in the outpatient setting. They know all the challenges. They know the patients' families. They know a lot. And you want to tap into their resource. And so the first thing I'm telling you is talk to them often. The patient comes in, you're not sure what's been going on before the patient came to the hospital when they get transfused. Sometimes it's as easy as picking up the phone, and they will give you a lot of history because they're always paying attention to these patients. The second thing is that if any member of the sickle cell rounding team calls you because they're worried about a patient, you should be worried too. They know the patients really well. And if a patient is just behaving in a way that's not consistent with patterns that are established and they're worried about the patient, they'll reach out to you and they'll say, hey, we've been following this patient, but we think that you should come take a look. You want to respect that and you want to go take a look. Okay, so definitely pay attention. If they're worried, you worry too. Okay. The other thing they do is they transition care. So they'll take care of patients in the hospital. And if a patient is stable, perhaps a patient had acute chest, needed exchange transfusion, you exchange the patient. Now the patient is doing better, has a decreased oxygen requirement. You can say, okay, well, our acute management of this patient is over, and then you can transition the patient to the sickle cell rounding team. And they are happy to do that for you as long as you talk to them and they feel comfortable that the patient is actually appropriate for their service at that time. Another way that the sickle cell rounding service can help you is they can actually sometimes see new consults. So sometimes the team will call and say, well, we need hematology to see the patient. And really, it's a stable patient who's here with a non-complicated vaso-occlusive crisis. Sometimes the sickle cell rounding team can actually just take over the patient right away without the Heme Consults team having to be involved. Again, talk to the sickle cell rounding team, and they'll let you know if it seems appropriate, and only share patients with them that are actually appropriate for them to see. So definitely if there's concern for acute chest, multi-system organ failure, anything that's acutely evolving, those will not be patients for the rounding service to see. The other thing they do is facilitate transitions of care. They help to schedule appointments for patients who are part of the system. So that's very helpful because it does take a load off your plate and having to worry about that. But again, you want to communicate with them just so that they know that the patient is imminent as far as leaving the hospital, and they can help to facilitate that transition. The other thing that they can help do is to facilitate difficult conversations. Now, the sickle cell rounding team is phenomenal. They not only know the patients, they know their families as well. And so if for whatever reason there's a difficult interaction with a patient, it's not going well, sometimes the sickle cell rounding team can help just give you some insight into how to move forward in that conversation. And sometimes they'll even help broker the conversation for you. So again, they're a great resource. Make sure that you tap into that resource. Finally, I want to leave with you that the sickle cell rounding team is a collaborative team. There are collaborators and we consider them partners. And so they are mostly a physician extender run service, and they deserve the highest level of respect. And I want to just say that as you reach out to them in humility and also pay attention and listen. They do have a lot to teach, and sometimes they will, sometimes they won't, but definitely treat them with the highest regard. All right. If you have a chance to talk with the sickle cell rounding team, definitely share with them how you appreciate their service. I'm sure that they would appreciate you too. So this week, I want you to try something. Before you round with the attending, if there are any patients with sickle cell on the service, run the list first by the sickle cell rounding team, especially if you have questions perhaps they may be able to help you answer before rounds. Imagine if at the end of 4 weeks, you have a lot of knowledge about patients with sickle cell and how to manage them, not just like medically, but also recognizing some of the social issues that go on for them as well. That would really be a great, great investment of time. And I hope you have the chance to do that. All right, I'll see you in the next video.